Thank you, Senator Lesser. I want to thank you for your partnership. I want to thank the chairs of the Appropriations Committee, the leadership in the House and Senate, and all my colleagues behind me. But importantly, I want to thank all of you because we heard you. We heard you, and we will be increasing Medicaid rates. Nearly 1 million individuals in the state of Connecticut receive their health care through the Medicaid program, and that's 1 in 3 children. And we know that these low rates mean that folks are struggling to access the health care that they need, and that you all in this room are struggling to hire the workforce or to retain them because the wages that you can provide are far lower than our surrounding states. We've heard from nonprofit behavioral health providers about the number of vacancies they have. It fluctuates between 40 and 42 vacancies, and that's because as soon as they get someone, there's turnover. With 7 vacancies in their child outpatient clinic, that's over 1,000 children here in the state of Connecticut not getting the behavioral health services they need. And those children are out there and need that service. We've also heard from knee surgeons who say that the Medicaid rate currently doesn't even pay for the cost of the prosthesis, for the knee replacement part. And so they'll take 1 Medicaid patient a year just to be nice, knowing that they're going to lose out. And then we hear from our community health centers, who with each dental visit lose over $120. Across their 17 programs, that's $10 million they lose every year. And that's because of us not increasing the Medicaid rates. But we're not going to let that happen anymore. We're doing something about it, and I'm so proud to be a part of that. You've heard the number 2007 thrown out quite a bit, and that's where we base the rates for many of the providers on, the year of 2007. I know many of us in this room hate to acknowledge it, but that's nearly 20 years ago. We also have some rates, though, that aren't based on 2007 because it's all across the map. And there's one rate that's still based on 1998. My son is a sophomore in high school. I was a sophomore in high school in 1998. Pretty absurd that we would still have that on the books. And so we are planning to rebase all of the Medicaid rates to current year, and then, as you heard, go to 75 to 80% of the current Medicaid rate. For those that don't have the equivalent Medicare, we'll be working to increase those rates as well. In addition to the phase 1 and phase 2 study, which was very helpful in giving us quite a bit of data to illustrate what many of us already knew, that the Medicaid rates were far too low, those reports did give us some additional insights. It made it clear that we need to establish a system to update these rates going forward, so that in 18 years, we're not back here saying that we haven't increased the rates again. And so we want that to be a transparent system, and we want it to be sustainable for our providers over time. And finally, I'll say one of the things we heard that wasn't included in the report, but that we're all committed to, is parity in the pediatric and adult rates. Maybe that was in the study. And that will provide more uniformity and avoid those cliffs. So when someone turns 19, the provider isn't paid less for the same service. So looking forward to continuing to talk with folks as we build out this plan, but just so grateful that we got to the point where we are all committed to raising these rates to both give people greater access and support the healthcare workforce. Thank you.